Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos, if I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. All right, you guys. So now we're going to hit the pediatric section for antibiotics. And you'll see, like I told you, as we've been working through all the systems, all of these are pretty straightforward just to get you that knowledge based foundation on what antibiotics we typically use. But next week, we will be starting back from the top of all of the systems and going a little bit deeper, where you're going to have to work through, you're going to have to look at the assessment findings, come up with a diagnosis, and then know what antibiotic to treat. Okay. So it'll get a little bit more difficult. Like I told you, I'm big on structuring how we study, and there's a method to my madness. And anybody that does my review sessions and one-on-one sessions, y'all know this is what I tell y'all. But I built this foundation. It's going to seem easy initially, but once you have it, you're going to understand why I did it this way. Okay. All right. So question number one for today. The nurse practitioner has diagnosed the pediatric patient with community acquired pneumonia. What is the best first line treatment option at this time? Is it A, Keflex, B, doxycycline, C, ciprofloxacin, or D, amoxicillin? Take a moment and tell me what you got, you guys. All right, so I always recommend reading the stem of the question first, as it allows us to slow down to ensure we're answering what is even being asked. So here, the stem of the question states, what is the best first line treatment option at this time? So if they're asking for a treatment, I always say run it back and look and see if they have provided you with a diagnosis. That's your first step. I don't care how long the scenario is, determine that. If they haven't, you need to take it a step further and look at the assessment findings so that you're able to determine what the diagnosis is, because we got to know what it is to be able to come with a treatment. Then this one is asking for the first line treatment option. So this is a pediatric patient who has been diagnosed with community acquired pneumonia. So your best answer is D, amoxicillin, as that is first line therapy for our pediatric patients. Question number two. The nurse practitioner has diagnosed the pediatric patient with acute otitis media. What is the first line treatment? Is it A, ceftriaxone plus doxy, B, Bactrim plus amoxicillin, C, clindamycin, or D, amoxicillin? Take a moment and tell me what you got. So, stem of the question is, what is the first line treatment? So here, this is a pediatric patient diagnosed with acute otitis media, and D, amoxicillin is the first line. Y'all know Brittany's brilliance that I tell y'all with acute otitis media is to think of the A's, right? Think of the A's. But one thing I also like to say, and before I go on that, think of the A's as an A with acute otitis media, A for amoxicillin. Then the next line is A for augmentin. It's the same for adults as well as our pediatric patients. So again, the best answer here was D, amoxicillin. But I also say that when in doubt with the kiddos, we're typically doing amoxicillin or azithromycin, okay? So keep that in mind if you get stuck ever. I mean, that's not always the case, but that's just like, hey, if you're really stuck. For testing purposes, y'all. Testing purposes, not practice. All right, question number three. The nurse practitioner has diagnosed the pediatric patient with community acquired pneumonia. The patient has an allergy to penicillin. What is the best treatment? Is it A, doxycycline, B, Bactrim, C, azithromycin, or D, ciprofloxacin? Take a moment and tell me what you got. All right, and stem of the question here states, what is the best treatment? So again, we got to look and see if they gave us a diagnosis, and they have. And this is a pediatric patient diagnosed with community-acquired pneumonia. But in this scenario, they are allergic to penicillin. So you want to go with C, azithromycin. So with this, we go amoxicillin as the first line. Then you can bump up to augmentin as the second line. But if they have a penicillin allergy, you can't do either of the two. One, amoxicillin is a penicillin, and then with augmentin, it has the penicillin component because it is amoxicillin plus clavulanic acid. So then you want to go to that third line, which is your azithromycin. So C is your best answer. And also for the last question, when I was explaining that when in doubt, we go with the amoxicillin or azithromycin, I also want you to think about it. You know how I told y'all when we were talking about antibiotics? In pregnant patients, penicillins and those macrolides like azithromycin are typically like those safer categories. Specifically, penicillins are the safer category. So think about that as well. That's why children typically those are those ones we commonly go to as well. So I know I say just think of that because it's commonly used as an easy way to remember, but there's science to it as well. But all right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one, at gmail.com. Now, the things that I do offer you guys are my review book. You can get it in an ebook or paperback option, both linked in the bio of this channel. If you're someone who prefers to study independently, I do offer a self-paced review for family and adult GERO designed for both the ANCC as well as AAMP exam. That's also linked in the bio of this channel. If you're looking to do any practice questions, I do have QBank options linked in the bio of this channel. And then lastly, if you're wanting to book any one-on-one sessions, I always say give us a call or shoot us an email because all of my one-on-one sessions are customized as I like to gauge what you truly need and structure your plan based upon that and tell you which one is going to work better for you. Now, the one-on-one options that I do have are you can book sessions for areas that you're weak on. You can book exam readiness assessments. You can book a question analysis assessment, or you can book you can book custom our custom package, and that is designed based off of but it is designed in a fashion that I give you a pre-test initially. Sometimes if you have been unsuccessful previously, I like to look at those scores as well so I can determine and gauge where your weaknesses are. And based off of the frame that you're looking to study and a lot to study in before retesting or testing initially, then I structure a study plan for you over that duration of time and work alongside with you throughout that period of time to take you to a successful board attempt. So if you are looking to utilize or book any of those options, just give us a call. I look forward to working with each of y'all, but y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.